and development. Her deepest passions are to learn, teach, empower, and to lead. Our second speaker is Ms. Shaftel Benson. She has served as the Quality of Life Health Service for over 7 years and currently holds the position of Community Outreach Officer. She has an extensive career in counseling, law enforcement, youth development, athletics, and healthcare. Ms. Benson manages a team of 12 who work to advocate, educate, connect, and inspire constituents in 18 counties and patients throughout 21 health centers. Then we are going to hear from Zufel Health Center, and our speakers are Ms. Michelle Blanchfield. She is currently the Director of Outreach and Special Populations at Zufel Health Center, developing and managing programs and initiatives that target homeless residents to target homeless residents of public housing, farm workers, and veterans, as well as overseeing outreach efforts to the special population. Her bilingual bicultural background was imperative in creating the success, sustainability, and growth of HOLA, Health Outreach and Literacy Awareness. HOLA is a health literacy program that was funded by New Jersey Health Initiatives of the Robert Wood Johnson Foundation. Our fourth speaker is Ms. Shay Cronin-Growling. She is currently working at Zufel Health Center she served as the coordinator for the Affordable Care Act outreach and enrollment and the program coordinator for the American Corps Community Health Corps program at Zufel. Her responsibilities include educating patients, the community, and other social service agencies about the healthcare law and how to enroll in expanded Medicaid or throughout the healthcare marketplace. Ms. Growling worked previously at the Ripple Foundation in Morristown, New Jersey, on a project that focused on redesigning the healthcare system around the triple aim of improved outcomes, improved patient experience, and lower costs. Other experience include working on a special project with the physician-in-chief at Memorial Sloan Kettering Cancer Center in New York. Ms. Growling received her Master's of Arts in Health Advocacy from Sarah Lawrence College and her undergraduate degree with high honors in psychology from Wesleyan University. Without further ado, I would like to turn it over to Ms. Parker. Good afternoon.
Health Center outreach strategies and insurance enrollment efforts. So to begin, I would like to just say a little bit about our corporation. Quality of Life, we are a federally qualified health center. We have been in operations for 38 years. We have 22 locations serving 18 counties. We're proud to say that we are JCAHO accredited since 1998, and we are also PCMH certified. My area of responsibility is related to special programs, and we work very closely with our community outreach division, and we are very connected. And it is essential that we work together in order to provide the most essential and quality care possible. The mission of our organization is that healthcare is essential and the right of every individual. Our vision is to continuously strive to efficiently provide healthcare services and education which consistently meet or exceed the expectations of patients, physicians, employees, and the community. So really to get into our topic of discussion today, which is related to health center outreach strategies, I wanted to begin with a central theme that is common among outreach slides, and that is meeting people where they are. Our corporation's motto is people caring about people, and we make that the center of pretty much everything that we do. However, when we talk about meeting people
Excuse me, Ms.
where
Porter.
they are, yes.
Can you make your slides bigger? Can you put it in a slideshow?
Okay. Hold just one moment, please. Okay, is that better?
Yeah, thank you.
Okay, no problem at all. Okay, thank you. All right, back to meeting people where they are. We definitely consider that physically going in the community is essential. We do not want to wait for them to come to us. A central theme of community outreach, as we all know, is meeting people where they are. Within our public housing development and our programs, we also serve our school-based centers as well as migrant health. We don't depend on our patients to come directly to us. We schedule events, we map out the different areas, and we decide on where we need to go and what's the best avenue to implement in order to get to those individuals and to serve them effectively. We present information and we ask questions in the language of the community. Of course, that takes some research. That takes knowing your population. Everything is not the same for everyone. So we have to tailor our outreach strategies based upon the specific populations that we are serving. Respect is essential. Respecting beliefs and traditions of the community cultures. Once you find out and determine what's true and valuable to that population that you're servicing, you have to take it very seriously and show them that you respect and are in tune to what's going on and can identify with the type of needs that they have. Also, what's important in order to be able to implement everything that's above is to recruit and to train community members to be a part of the outreach process. People like to see others that they are familiar with, that they can be in tune with, and quality of life strives at its best to recruit staff and also volunteers in many of the different population groups that it serves, so our clients and our future patients and customers can really feel comfortable with us and know that we respect truly what is going on with them. Also behind general outreach strategies that we have found to be effective is knowing that it is a client-driven process. What we mean by that is that we want our clients to feel comfortable enough and for us to know that we respect and value them so that they will feel empowered to ask the questions that they need to ask for us to know how to best serve them. Also, a part of that is stating their needs in a clear manner and with ease. Again, that goes to just being comfortable with the outreach team members, with the medical team, with the provider that they may be seeing. They have to be, they have to feel at ease in order to be able to speak clearly and be able to identify that, which is our next point, identifying barriers to meeting those needs. Sometimes in order to be able to accomplish what needs to be done, there may be potential barriers, such as transportation, for example, such as language. That is another example. We have to be able to identify those needs in order to best serve them, and then describing how to meet those needs. Sometimes we may feel that we have all the answers, but a lot of times we need to rely on our clients and our consumers to share with us of how they feel that we could best meet those needs, what they feel they need to be successful in whatever that need is. So the whole focus of this area here is to make the patient experience client-focused and client-driven in order to have the most successful outcomes. Now, to kind of tie all of that in, I did more specifically want to tie in our relationship and discuss our relationship with our public housing authority. As mentioned earlier, we do have funding for a public housing primary care program, and our outreach for that program is truly the central theme, ensuring that it is a successful program. First, I would like to discuss keys to our successful partnership. And I would like to also say that we have been in this relationship for over 20 years now. And throughout the years, we have grown to have a very meaningful and effective relationship with our co-partner, Grady Gaston Housing Authority. So, keys to successful partnership: providing quality, affordable, and accessible health care. That's essentially how this all got started. Our executives here, as well as their executives, got together and had the common thing of wanting to provide the best quality care for the residents in public housing. So that central desire and focus was the stimulant in order for us to even apply for funding 20 years ago. Of course, that ties into commitment of the key stakeholders. Without commitment, then the program would not be successful. And it truly takes a buy-in by the CEOs and executive directors of both organizations to ensure that staff can really do what they were hired to do and perform at their highest level when we have that commitment from those key stakeholders. Trust and respect, presence and visibility in the community, in the public housing communities, at the meetings, that is just an essential component to show them that we truly are in tune with their needs and we care about their health. Always having a open line of communication. Really, the open lines of communication is such an integral part of this, particularly with the housing authority. So we will know really what the residents' needs as well as their needs are and able to fulfill any type of demands that they may have. Moving on to coordinated events, we have various events together from all of the age groups, ranging from our students, the children within public housing, all the way to the adults and senior populations. Senior picnics, there's an honor roll program. We all coordinate efforts in order to show the residents that we are working as a team. And when they see that we are true partners in meeting the health care, then they really will come to see us, and they really will trust the providers and team that's on staff. And then exchanging information, that definitely implies monthly reports, quarterly reports, attending advisory council meetings in order to know what impact that we are having on the public housing community. Moving next to successful outreach strategies. Some of these may be a little repetitious from what I just mentioned, but they are essential in really meeting their needs. Again, meet people where they are. Remain respectful and listen to the community. Show them that their voice matters. Let them know that they are a part of their care. Again, client-driven process. Building that trust and relationships. Spreading the word out in a non-stigmatizing manner. Again, we have to be in tune, with the culture that we're dealing with. We have to present information, and we have to talk to people in a manner that they understand and that they are ready to receive. So that is truly, truly important. And then offer service and information in a variety of locations, such as doing home visits, which we are just really so proud that our clinical team are open and willing to do at any time when it's called for. We try to meet the patients where they are, particularly our senior population. There's one example when we had a patient that was 100 years plus, and she was unable to get to her visit. So our team of course, went out to her and ensured she had the health services that she needs. So again, each individual patient is different, and they have different needs, and we have to assess them that way. Just a few more strategies. Make written information friendly and easy to understand. Strive to be timely. Let patients know that we value their time and that we will not send them or hold them in our health center no longer than it takes for them to have the type of services that they need to get well. Remain credible and sensitive to their needs. If you say you're going to do something, do it. The worst thing you could do is get a bad reputation in the community. So we want to be true to our word, and that's something that we have been committed to do throughout this program. Organize and publicize outreach efforts and events. Provide information in the primary language of the community. We discussed that. And the one last thing that I really want to emphasize, and it may sound simplistic, but it's truly important, and it's follow-up, follow-up, follow-up. We can start the process, but we also want to make sure that our patients follow through with what's being asked of them, with what the providers have directed them to do. And we take our role in outreach and even in the health center very seriously in ensuring that we follow up with the needs of our patients. With that said, I do want to now move on to our outreach and enrollment section, and I will turn the floor over now to my colleague, Ms. Chantel Benson.
Good afternoon, all. Let's start by talking about what's going on or what's happening in Alabama. First, the governor did not expand Medicaid, which has reduced the number of constituents that can obtain health coverage through the marketplace. Our Alabama Primary Health Care Association is the #1 PCA in the country. They have a dedicated team of individuals who are easy to access, and they keep us abreast of state and national updates daily and on a monthly basis through their monthly newsletter, as well as motivate us and work with us to be with our community events. We have 16 FQHC organizations in the state of Alabama. Quality of Life is the largest network with the highest number of health centers, having 21 health centers in service in 18 counties. And again, we have the best CEO, Mr. Wayne C. Rowe. Blue Cross Blue Shield, Humana, United Healthcare are our primary insurance carriers in the marketplace. In 2014, over 97,000 people in Alabama enrolled in a health plan. Over 170,000 people enrolled in 2015. And since November 1, with this open enrollment period, over 80,000 people have enrolled. Quality of Life has assisted over 12,000 people and enrolled over 2,000 people in the previous open enrollments. The impact that Quality of Life has had with the ACA. Our CEO, Wayne Rowe, has implemented our outreach team. 5 years ago. He continues to support the efforts of my 12-person team and the other 300-plus employees that we have here at Quality of Life. Our outreach team is looked at as the foot soldiers of the corporation. ACA has given us an opportunity to provide additional services in our community, has increased the number of insured patients that we have, as well as has connected those individuals who did not qualify for a marketplace so that they can have a quality medical home to service them. We build up an eligibility screening into our center operations, including the patient care, our billing cycles, and our transportation services. We work to provide advocacy, patient education, affordable health care, bilingual services, and direct specialty care for our school-based public housing, farm worker, and homeless programs. Our works involve the delivery of services, as I indicated, within our 21 health centers, as well as the 18 counties. As indicated earlier by Ms. Parker, it's important that you know your community and you develop meaningful professional relationships that will provide resources for our patients and our clients. We work well with most of our elected officials, community action agencies, parks and recreation, colleges, cooperative extensions, public housing and community programs, libraries, boys and girls clubs, education nutrition programs, churches and volunteer programs. We understand that it is essential to have partners and professional relationships. How did we prepare for open enrollment this time? Well, we had ongoing communication throughout the year with our PCA. We're part of our state ACA coalition, which is headed by Alabama Arise, with a strong input and emphasis for health and human services. We partnered with and hosted a minimum of 3 patient and community events during the special enrollment period. The first 2 open enrollments, we had 8 employees who received their certification, CAC certification. This open enrollment, we had 12 individuals that we had trained and certified. With the provided physical support, it added a bilingual employee to this fold, an individual who does primarily work with our school-based services, as well as an individual who primarily works with our public housing services. Online research was paramount. Healthcare.gov, Blue Cross Blue Shield, NAC, CMS, HRSA, In the Loop, HHS, and Medicaid have proven to be some of the best resources to keep us abreast and current with information regarding the ACA in the marketplace. We called and U.S. mailed our clients from previous open enrollments. We hosted coverage to care forums, with a few of those forums being brunches, which went over really well. You can always get to individuals and you give them a free meal, a gift, and they get a first-hand look at our main complex, which houses our administration services as well as all of the other clinical services that we offer. We updated our customized general ACA PowerPoint and flyer. We have a frequently asked question flyer, which has gained positive feedback throughout the state from our colleagues and has been shared. We educated our colleagues through what we have a standard ultimate performance practice meeting. This small forum allowed us to thoroughly educate our colleagues about the affordable health care. It provided them with the information as far as which one of our employees are providing service to their immediate community and area. And it allowed us to empower them. So in the absence of a CAC, our PSRs, which are front office people, they can then answer questions and try to assist clients as well as they can, as much as they can. O&E best practices, hands down, I got the best O&E team in the country. Due to the varying types of people that we service, it was important that we hired a diverse group of professionals. Our team is comprised of customer-friendly, flexible, creative, and experienced African Americans, Europeans, and Latinos. We have a wealth of experience on our team, from banking, biology, accounting, entrepreneurship, nutrition, marketing, law enforcement, and music. And all of these different skill sets are so important for so that we can address all of the diverse populations that we service. We also have a former Quality of Life board member that is a full-time certified application counselor. Not only did this individual bring a strong leadership skill to our team, but she also brought a wealth of experience and information to help us to develop and expand our outreach program. We learned and we developed our team through trial and error. We participated in a 30-day onboarding process initially with this team. It allowed us to introduce the team to not just the ACA, but to all aspects of the community health center. Because when they are not during special enrollment periods, these individuals do have other responsibilities under outreach services. So it was a need for us to equip them with the full gamut of FQHC. The first time that we went through the open enrollment period, or the certification process, there were 7 of us in one room. Everybody had a laptop, and we worked at our own pace. But what we did was we recapped at the end of each test to make sure that everybody in there understood what we were trained on and how to be able to deliver that same information. Since that first open enrollment, we do test individually at this point, but we do have regular dialogue after everyone has received their certification. The certified application counselors for Quality of Life are truly role models. They're flexible and responsive, funny, well-versed in the marketplace, and with various tax provisions and health plans. They do a very good job communicating this information to colleagues and clients. I speak with everyone on my team weekly. Most of the time it is about quality of life responsibilities, but I also find myself calling them just because I haven't talked to them and I want to make sure that they and their families are okay. We have a bi-weekly 30-minute conference call, monthly full team meetings. and everybody participates on one of our special committees, and those committees meet monthly as well. Next slide. We have a ACA resource library, which is available to all of the CACs. Within that library, we have all of our marketing and our tracking tools. National ACA directors are listed on there, as well as the pictures from all of our events and inspirational messages. I encourage the team to upload relevant, traditional and non-traditional information that could be helpful and beneficial to someone on the team. One of our in-reach efforts, we conduct patient service calls where we do a sampling of calls of our patients who have recently had a visit to one of our providers. This one makes the patient feel valued, that we've taken the time to call them within 72 hours of their visit to see if their health is improving. It also allows us to remarket our additional services and promote the ACA. It allows, and it also provides a good sense of customer service within our centers, because we have oftentimes clients want to talk about how they're feeling, but they definitely want to talk about the experience that they had within our center. So this helps us to correct any issues immediately, address any problems, and hold staff accountable. On to the next slide. The client is the heart of the matter. We have worked to create patient-centered services. We exemplify people caring about people, which is quality of life models. Our CACs have exceeded the expectation when it comes to developing trust with their clients and with delivering complete and quality services. A lot of our clients like to share their experience with their CAC, and I have not received a bad comment from any CAC in the past 3 years, which is a testament to the quality professionals that we have on our team. What has been a challenge, though, is that this open enrollment, we have found ourselves over these first few weeks working with those individuals who had insurance, who may receive, they've had a lot of questions after receiving information from Blue Cross Blue Shield indicating that their premiums were going to go up, in some instances double. So that education piece has taken up a nice piece of our time, this open enrollment. The other thing is, because we have certain communities that have higher number of interested clients, we have to, I've been trying to reroute or reassign them to other CACs, and most of them have an unwritten allegiance to their counselor, and they really want to work back with the counselor who helped them in the past. It's real similar to if you have a doctor that you're used to seeing somebody else is sometimes questionable, or you want to delay your visit so you can see the provider that you're most comfortable with and have seen. We spend a lot of time coordinating our message in our PowerPoint presentation, our marketing materials, and our tracking tools, and we wanted to make sure that not only did our client understand the information that we communicated, but they understood the value of health insurance and the benefits that it provides. I'm moving a little fast for the sake of time. We're going to move on to the final slide and talk just briefly a little bit about our tracking tools. We all know that if it's not written, it didn't happen. Our tracking tools are all customized. We did use some of the resources that were available online, but we know our audiences. So we work to extract information from the online resources, develop materials on the 4th grade level in English and in Spanish. One of our best practices is a pre-screening form that we use, which allows us to cut down the time significantly with clients, that you can assess whether they will be exempt or non-exempt from the marketplace, and that we're able to schedule those individuals with a CAC based on those that may be ready to enroll or capable of enrolling at this time, and those that may be non-exempt that will just need more education about our SQAC and how to access the health services that they need. We do daily and monthly reports, extract information about the number of assists as well as the number of enrolled. We provided a script for our PSRs, or front office individuals, to help them to communicate some of the ACA services in our absence, and then provided them with referral cards and a tracking log, so that when we were unable to answer those phone calls when they tried to contact us, the referral cards are sent to us daily and allows us to follow up within a 48 hours. Our team is willing to do what is needed and wants to do what is expected. In a nutshell, I encourage everybody to sharpen your mental and physical toolkits, get creative. Social media provides you with a wealth of tools and resources to do that. Prepare for a brand new demographic, enhance the enrollment experience, promote the coverage to care revolution, encourage greater retention of coverage, and cultivate consumer autonomy. So with that said, we will now turn it over to Zufall.
Good afternoon, everyone. As we pull up our slides here, just want to say thank you for that, both of those really great presentations. This is Michelle Blanchfield. I'm going to go over general outreach strategies and really touch upon areas that are a little bit different than my colleague in Alabama. So first of all, when you think outreach, you're finding ways to connect with people that have not yet been connected to services. And what we find is one of the best and most effective ways to do that is to do some in-reach, which means connecting with your current patients and finding out how you can use existing patients to connect with others. Everyone has family, friends, neighbors, people that they talk to. And word of mouth is the most effective way to spread the good news and positive reviews about a specific provider or a location. So definitely think about how you can use your existing patients to connect with others. When we talk about a community presence, we want to make sure that we're connecting with the right people, right? And you want to maintain certain relationships. So think about this in two different ways. One is connecting with people, connecting with organizations, different coalitions and boards to maintain a presence. But then on the other hand, you want to not just maintain, but proactively engage in activities where you're impacting your focused targets. So engagement is different than just maintaining, right? You can go to a local meeting that meets regularly once a month and sit there and stay informed and give them updates about what's going on. But when you're what's going on in your health center and what new programs are there and what new events you're hosting or what events you're participating in with other partners in the community, but when you proactively engage with the community, you're engaging in activities that, whether they're intermittent or ongoing, are impacting your focus targets. And so what is a focus target? In this case, let's think residents of public housing. So where we are in northwestern New Jersey, we have 8 physical sites in 6 different counties. The majority of our public housing residents are seniors living in public housing, but we also do have some family public housing sites. And as most other health centers, at least in this case, we serve everyone, newborns through seniors. So you want to make sure that you're communicating with your clinical directors and finding out in the management at your organization to find out what are the clinical goals. Do you have to increase the number of Pap smears, for instance? And if that's a clinical goal, then your targeted focus for that period is going to be females. What if you need more pediatric patients? So then you know you want to engage in activities around family events. So make sure that you're in touch with other people at your organization to find out what the clinical goals are, and maybe there are grant requirements that you have to meet. So you want to align those with your target outreach and make sure that you're focusing on the right populations. And then, of course, in our case, Zufall, we work very closely with our clinical departments, both medical and dental, to make sure that we can use our mobile units as a way to reach out to our public housing residents and our other special populations. So we form these relationships with public housing managers. We foster the relationships by having open lines of communication, meeting with them regularly, asking them what their residents need, and then following up and regularly scheduling our mobile dental unit or our mobile medical unit to go and provide services on site. And our clinical department is there and they're available. They support us by making sure that they provide us with the resources that we need to conduct appropriate outreach efforts and connect our target populations with clinical services. Also, it's really important to collect the data, so make sure that you're keeping track of new public housing patients that have come in. If you have mobile units, have a calendar so you know when your units are going out to certain places, how many patients were seen on the units. And then when you do regular outreach events, you might be going out to present. You might be meeting a new manager, or perhaps you're meeting with a local board of health in their department to talk about services that are available specifically to your public housing, to the public housing residents. Keep track of all those, even just the meetings and the events where you're presenting, or you might have an outreach table. So maybe you don't have clinical services, but at the family public housing unit down the street, they're having a huge, summer barbecue, and they have a number of services available, and they ask you to come with an outreach table. So you have your materials and your giveaways, you have your literature. Keep track of the number of people that you talk to, and you can do that simply by measuring the supplies that you arrive with and then subtracting what's left, right? And then keep track of that. What we do is we use an access database that has a simple, you insert the title, the date, the type of the event, and how many giveaways there were and how many people you possibly reached. And that's always good to know, because that way, if a new patient does arise from an encounter that took place at an event, when they come into the health center, at our intake process, one of the questions, if it's a new patient, is how did you hear about us? And one of the options is at an event. And so that gives us, to some degree, an idea of our outreach efforts and how that equates to new patients. And then finally, social media is everywhere these days. If you guys have a Facebook account, if you have a Twitter account, make sure that you educate your existing patients and any potential patients about those social media sites and how they can connect. We find that it is useful. Since we've begun our social media, since they've been in existence, we have had greater and greater numbers of people connecting with us, liking us on Facebook. So definitely try to do that. It is difficult to maintain unless you have one specific point person that's accountable for maintaining that a presence on your social media, updating it, posting, responding, because sometimes people will leave comments. So that's huge. But also, if you do have social media sites, educate your patients about those social media sites. We had a social media campaign where we just had literature that said, connect with us, and then it had the logos. So definitely do that. Okay. Some general outreach challenges. Obviously, resources are limited. We have a limited number of staff. We have a limited number of materials. Oftentimes, people are requesting materials for X, Y, and Z occasion, and they want multiple types. We want your dental cards. Oh, we love this general flyer. Can we have more of them? So keep on top of that. If you're a health center that has multiple sites, you want to make sure that your sites have material at their disposal so that they're not running out, or they don't have to wait a week to get it from the main location to the other, to one of your satellite sites. So keep an inventory of your material. Make sure that your staff is taking turns to attend nighttime and weekend events and or meetings, because again, You don't want anyone to feel too overwhelmed and taking on the burden of doing that all the time. So, and also, money's limited, right? So in my outreach team, we travel to attend meetings and go to events. And since we are dispersed geographically, we're limited. We have to think strategically about where we invest our energy and our money and our time because things are so limited. So again, think about that in terms of your target populations, think about your clinical goals, think about the partnerships that you have with the other members in the coalition, for instance, or at the partnership that you're attending, and focus your efforts on where they're going to make the most impact. And follow-up. Follow-up is huge. I know the first presenter had mentioned that towards the end of her slide. And that is a challenge because when you are attending and meeting, so you're meeting new people, you're connecting with various community leaders, for a ton of different reasons, right? One could be a program around diabetes, and another could be a public housing special event that you're planning for the spring. And one meeting, I don't know if this happens to you guys, but it always happens to me, one meeting results in 2 or 3 other meetings that you have to follow up and 2 or 3 other connections that you have to make. So follow-up is critical. Make it a point to, after an important meeting, make a note in your smartphone or in your notebook and highlight specific name and just 1 or 2 words on what the main reason is that you have to follow up. And try to do that as soon as possible because otherwise you're not going to remember exactly what the conversation was. And sometimes these connections happen very quickly and you don't want to lose the opportunity to connect with someone to further your cause. So follow-up is critical. Another challenge for us here at Zufall is coordination among various programs that have an outreach component but that aren't necessarily entirely outreach. They're programmatical, so it might be a sexual assault prevention program, teen pregnancy prevention program, it might be a cancer education program that have their own grant requirements, but at the same time, there's outreach incorporated into them. So streamlining communication so that anyone and everyone that's connecting local residents to resources in the community, be it your healthcare center services or something else, are somehow communicating and everyone is informed and aware of the activity that's taking place around that outreach for the program. Because otherwise, what ends up happening is you get multiple people from one organization trying to contact and form a relationship with the same place, and that leaves the target organization or place that people are trying to contact bewildered and thinking, why are 4 different people from the same organization trying to contact me? So coordinating outreach and communication that way can be tough, but it can be done. So if you have, unless you have one person tied to one physical location or a team tied to a physical location, you can alleviate some of that. But if you have one outreach team and it's one team that's trying to outreach and connect residents to services throughout your areas, that can be challenging. And finally, planning. I think planning is half the battle. If you can have an outreach plan for your department, and then specifically have your team members create their own work plans, which lists activities, goals in terms of measurable goals, right? So they're SMART goals. They're specific, they're measurable, they're attainable, they're realistic, and they're time-bound, right? So increase the number of pediatric patients that are being referred from X location by 10% from May through November or whatever like that. if you can have very specific goals for the outreach team and per team member, that makes for much more effective work. And they could be living documents, but plan, and the team members' work plan should be based on the department's goals. And the department's goals should really be the department's goals should be based on the organization's goals. So if your health center has a strategic planning meeting once a year or every other year where the managers and executive staff come together to strategically plan out everything, right? Part of that is going to be outreach. And you use that to create your department plan and then base that off your team members' individual plans. And make sure you meet with your team regularly. Team members should meet, have department meetings, talk to each other, and talk about their deliverables and how it's going, because it's a working, living document, and you have to reevaluate, reassess, and sometimes come up with some new goals that work better. Moving along to what sets us apart. So what message can you send to patients that says, our health center is unique and sets us apart from other private doctor's offices because? So what we try to focus on here are the community linkages, right? Health centers, we play a critical role in connecting people to services, but not just to our services, to services and providers in the community, other social service agencies, whether it's SNAP, right, food stamp eligibility, outreach and enrollment, food shelters, or rather food pantries, shelters, whatever it is, educational programs, after school programs. We let our patients know, like, hey, we're knowledgeable about this. You can come to us and ask this, and it's proof because they know that our outreach staff can help them with those needs. So that sets us apart from other private physicians because you're not going to get that at a private doctor's offices. Multiple offices, we're unique in that some of our patients live right equidistant between two offices, so you can choose which office they want to go to. If usually our providers are tied to one location, but not always, so they might be able to see a provider one day in one location, another day in another, and that's convenient for some people, especially if you live in one area but work in a different town or city where we have an office. So we have multiple offices, which is great. We also offer a number of ancillary services or enabling services. So we have patient navigation. We offer translation services. We do case management. Obviously, outreach and enrollment is something else that we do. We offer transportation for some of our special populations, and we have our mobile units that go to the locations. We also have classes that we offer at our wellness center. So, and even at one of our other clinical sites, we have yoga classes, Zumba classes. We have classes targeted at helping to prevent childhood obesity among at-risk youth. So these other ancillary services that set us apart, we also educate our community about the things that we offer. And finally, we don't shy away from highlighting what we've achieved, and any awards that we've gotten for clinical excellence, you can see them prominently displayed when you walk into our health center. So that's something else that you should be proud of and make that visible. We also, anything that you can do to kind of set yourselves apart from other providers. For instance, if you can use your space, if you're lucky enough to have ample room at your health center, and you can offer other community organizations a space for a meeting. Maybe it's a monthly meeting that you attend regularly on a coalition, and you could say, hey, we always come here, but let's rotate, and we can use our meeting space. Bring people into your health center, let them see what it's like. We've also started having art displayed in our patient waiting rooms and throughout the corridors of in our clinical sites. at one location. And we started that through a grant with a local arts foundation, where every quarter we have an art show and we invite the community in to see professional artwork displayed that they would otherwise not be able to see. So try to think outside the box and engage local partners in how you can use your space for the benefit of the community. And we also, obviously, we offer comprehensive care. We're proud to say we're a one-stop shop. We tell our patients and prospective patients, you can get all your healthcare needs met at our locations for your whole family, medical, dental, newborns through seniors, and we even have some specialists on site. So that's also unique. And finally, potential partners. So all the regulars, obviously, right? Faith-based organizations, schools, other nonprofits in your community, and then stakeholders. Sometimes, for instance, find out what associations exist locally that either target your same target population or an affiliate of. So, for instance, recently I connected with an association in Northern Jersey for farm market managers, and you wouldn't typically think that people that manage farmers markets are who we're trying to reach out to, but if we're trying to reach out to farm workers, then they're connected to these farm market managers somehow. And believe it or not, there's even some farm market managers that have local vegetable and fruit stands at a public housing site. So sometimes, you think outside the box of ways that you connect with people. Our primary care association is also a partner of ours. We use them as a resource if we have questions around certain needs for training needs, or wanting to connect with someone who we've had trouble connecting with. They can usually help us do that. Adult daycare and lunch programs, we also connect with in order to reach out to our seniors in public housing. Recognize community leaders, so people who may not be your typical community leader but are recognized within a community as a leader. You definitely want to get to know who those people are and connect with them and talk about what your goals are and how you want to help impact the health of your community. And finally, local, both large and small businesses, you can reach out to help support your events. They might want to donate supplies, snacks, water. We have a number of businesses here in Northern New Jersey that we often reach out to ask for donations to help support our events. And a lot of times, once they get to know, depending on the type of business, if it's anywhere in the health realm, or health field or healthcare related realm, they oftentimes will ask if they can participate. Maybe they can volunteer and help out. You never know who has connections to funders for possible resources and funding opportunities that you might want to apply for. And lastly, our elected and appointed officials. We try to use them as strategically as possible in order to help connect with their constituents. So thank you so much, and I hope that you enjoyed this portion of the presentation. I'm going to now transfer you over to Shade Grayling, who's going over specific outreach and enrollment techniques.
Good afternoon and good morning to the webinar participants, depending on where you're located. Thanks, Michelle. As she said, my name is Shade Grayling. I'm the Affordable Care Act coordinator here at Zufall Health. And I know that we started a little bit late. I recognize that it's after 2, so I will go through as quickly as I can some of our approaches to outreach and enrollment here at Zufall. And I know that we wanted to leave some time for questions for all the presenters at the end. So just to begin, our outreach and enrollment approach really follows many of the same general approaches to general outreach that Michelle had spoken about already. And like our colleagues in Alabama, we definitely go to where the people are. I think that's really important. particularly around outreach and enrollment, that we still struggle to get the word out about this, and there's still people with many, many opinions about the Affordable Care Act, and so we really make every effort to bring our outreach to where people are located and not to add an additional barrier to getting them always to come into our sites. We certainly offer culturally and linguistically competent services. So again, most of our Affordable Care Act counselors are bilingual. We serve a largely Latino population here in northwestern New Jersey, so we make sure that as often as we can, we offer services in the language that is most appropriate for the patients and consumers that we serve. And if we don't have that resource, then we will find a translator who can assist us. We also make sure that we have hours that are available to meet our community's needs. So many of our patients are working multiple jobs. It's difficult for them to take a day off to come in and do an enrollment appointment. They won't get paid from their job if they take a day off. So that we try to have hours in the evenings, hours on the weekends, to make sure that we give as many opportunities as possible for folks to access our enrollment services. A lot of what we do is educate. We educate our staff, we educate other agencies that we work with, we educate our patients, and we educate the general community. And we want to make sure that all of our materials are at appropriate literacy levels and in languages that are needed, again, so that we can reach the most people that we can with this information. Like many other parts of outreach, we work with trusted community partners. Zufall has been around for 25 years, but we've also expanded into new communities over the last 3 to 5 years. And so we try to partner always with other resources in the community that are trusted by the residents that are there. In terms specifically of outreach and enrollment, we work with other navigators, other groups that have certified application counselors. We have a team of 4 staff, full-time staff, including myself, that are outreach and enrollment staff that are certified application counselors. We also have a team of 8 AmeriCorps Community Health Corps volunteers that are trained as CACs. So we have a total team of 12 that serve in this capacity. And so during peak enrollment times, as we've had over the last week or so, we certainly partner with other agencies. If we don't have capacity, then we want to make sure that we can refer our patients and consumers to another site so that they have reliable service in the time that they need it. We also partner with other social service agencies in the communities that we serve, soup kitchens, homeless shelters. A lot of my other colleagues have talked about this already, but again, we do that both to share information with the staff of those agencies so that they can reach out to the clients that they serve and share information about the Affordable Care Act. And in New Jersey, we did expand Medicaid. We're fortunate in that, and so that we're sharing information both about expanded Medicaid opportunities and Affordable Care Act information. So we want to reach both the guests and the clients of all of these agencies, but also the staff, so that they can then pass on that information to the people that they serve. Like our colleagues in Alabama, we work with other community resources, libraries, county colleges, daycares. We attend other local events, local health fairs, so that we are a face that is recognized in the community and that people develop trust with, and that they will come to us for information, or when we bring information out into the community, that they will feel comfortable and trust that information. We also work with faith-based organizations, and again, I think that's important. Many of those organizations are very trusted in different communities, and so when we can partner with them, it helps us to begin those relationships with the people in those communities, again, so that they will feel comfortable reaching out to us for outreach and enrollment services. A lot of the information that we work with when we're doing outreach and enrollment appointments is really important, protected personal private information. And so we need to develop that trust so that when people are discussing their income and their family situations and sharing their social security numbers and immigration document numbers, that they know that that information is protected and that they feel confident in doing that, and that they'll get the information that they need. to that end, it's really important that we train our staff appropriately. Again, all of our CACs have the healthcare marketplace certification through the federal government. We spend a lot of time training our staff on the health plan details. Like our colleagues in Alabama, we work with the insurance companies that are offering plans through the marketplace. New Jersey works through the federal marketplace. We have 5 insurance companies that sell plans here. We work with our colleagues at CMS, the Centers for Medicaid and Medicare Services. We work with our colleagues at Family Care, which is our Medicaid agency here in New Jersey, again, so that we ensure that our staff has as much detail about each of the plans that we can, so that we can share that information with the consumers that we serve. There's so much information out there, and much of the burden has been shifted back to the consumer to understand all the details of these health plans as they make really important decisions. And so we've become sources, hopefully trusted sources, for information about those plan details so that people can make the best decisions for their families. We've also had to learn a lot about different immigration statuses and tax information. We are not experts in either of those areas, but it's really important that we understand those pieces of information, again, to make sure that the clients and consumers that we are working with have the best information possible to, number one, input their information correctly on their Medicaid or Affordable Care Act application, and then to understand the steps that they need to take in their follow-up when filing taxes, and to understand what their obligations are so that the process is followed through even after their initial enrollment is completed. And again, really important to train our staff around cultural competency and humility, that we work with people from many different socioeconomic backgrounds and racial and cultural and religious backgrounds, and that we want to make sure that we respect those traditions, and that we come in and listen to what the needs of the communities are, and that we understand the backgrounds that people come to this process with, so that we can serve them as best as we can. There are always specific issues that come up with outreach and enrollment that are a little bit different and a little bit unique compared with general outreach that we do at Zufall. There still is a significant lack of education and information about the Affordable Care Act. There's still many people in the state of New Jersey that don't know that Medicaid has been expanded, and even if they've heard those terms, they don't understand really what that means. They don't understand that they maybe weren't eligible a couple of years ago because they weren't part of a unique group that was eligible for Medicaid, but that they are now, and that they may not be able to access certain other services if they haven't applied and tried to apply for Medicaid in New Jersey. There's still a lot of misunderstanding about how the Affordable Care Act works, and that people are buying private plans, not government insurance, when they apply, and how the tax credit works and what the plans include. So I think we spend a lot of time doing education, again, both with our patients, doing in-reach and doing outreach with the broader community and consumers, and with other partners in the community, so that, again, that they can pass on accurate information to their clients. One really important message that we talk about with our staff a lot here is to never assume anything about anyone that you're assisting. We work with people from many different backgrounds. Every family and individual is unique, and we need to take the time to listen to those stories about each family to help them get the right information so that they can make the best decisions about selecting a plan that they need for their family. I think that it's really important that people take the time to understand what medical needs and health needs of the family is, who their providers are. Do they participate with the insurance plans that they're looking at? Do they take particular medications? We need to check the formularies of those plans and make sure that they're covered. We need to look at how often someone uses healthcare. Do they have a chronic condition that they need to be visiting the doctor regularly? So I think, again, we don't want to ever assume anything about anyone, and that we want to make sure that we really listen to the clients that we're serving. That speaks to the case management aspect of outreach and enrollment. And I think also that there's a lot of ongoing education after after someone is enrolled, educating them about how to use their insurance and what does a copay mean, what is a deductible, and how the insurance actually works once they have enrolled. So I think it's important that with outreach and enrollment, as Michelle spoke about and Ms. Parker spoke about, that follow-up, and that we want to make sure that if someone has applied for Medicaid and they get a letter back requesting more information, that information gets sent in and that application can be completed successfully. We want to make sure that once someone chooses their insurance that they then know how to use it and they haven't purchased something that then sits idle in their wallet, that they really know how to take advantage of the resources that they now have access to. So I think, really importantly with outreach and enrollment is that follow-up and really tailored follow-up for the different families that we work with. So that really is case specific to each one, and it's why that piece of it takes a lot of time even after the enrollment is complete. So that's all we will share about our outreach and enrollment here at Zufall, and I'll now turn it back over to Jose.
Hi, this is Joy. Thank you all so much for your presentations. They were absolutely wonderful, and I apologize that I wasn't here in the beginning. We're now going to open the floor up for questions. So if you have any questions, you can again enter them into the chat box, which will be at the bottom of the webinar toolbox on your screen, or feel free to press the raise your hand option, and you will be able to ask a question. Are there any questions? I know, TJ, I believe we had a question during the webinar. Is it possible to open that up?
Yeah, I can. Yeah, I see it right here in the question section.
Okay.
The question was just, could we get copies of each of those slides?
Okay. Yes, copies of the slides will be available online within the next couple of days, along with a copy, a recording of this webinar. So feel free to go back to our website, National Center for Health and Public Housing, and you'll be able to get a copy of the slides and a recording of the webinar. Are there any other questions or anything anybody want to add in terms of outreach and enrollment? Okay. Well, again, thank you so much to all of our presenters. Thank you so much, Karen, Shabtel, Michelle, and Shay. We really appreciate you taking time out to share with us your wealth of knowledge and your experiences from your health centers. Again, I really appreciate that we were able to have a rural perspective and a more suburban, urban perspective, because that covers the different geographic locations of our webinars. As I mentioned before, you can visit our website for a copy of the webinar. Also on our website are monographs, fact sheets, newsletters, and different resources that we have to help you in better serving your residents and serving your special population. You can also email us, and you'll be able to join our mailing list and receive funding updates, CMS updates, information on senior programs, on programs for low-income residents, and different services and resources that we have available and that we come across. You can also follow us on Twitter at NCHPH.org. So at Twitter, it's at NCHPH.org. And again, feel free to contact us with any questions or concern that you may have. If you have a grant coming up, you need assistance with that. If you're looking for additional funding to help you with your outreach and enrollment efforts, you can contact us. If you want to get in contact with the presenters because someone said something that you thought was really valuable, but you don't have a question today, but you may have one later on, again, please don't hesitate to contact us. We are totally here to serve you and give you the resources and assistance that you need to serve your special populations. Thank you for joining us on this webinar. We want to wish you a happy holiday and an awesome, fabulous new year, and we look forward to serving you in 2016. Thank you.
Thank you.
Okay, then you just hit stop recording.